Platelet-rich plasma, PRP, has been around for a very long time, and it's a great way to use your own body's fluid or blood to provide the growth factors that you need to enhance healing. Blood itself gets spun down, so we draw blood from your own body, we spin it down in a centrifuge, and then we can inject that back into different body areas that are painful or inflamed. So athletes who have tendinitis, ligament tears, muscle tears, or anything like mild to moderate type of pain may be a candidate for PRP to help. The treatment can happen, it can be repeated in about a month if we need to, and we could do it again in the future. So it's a great alternative to steroid injections, great alternative to surgery, or sometimes even an enhancement to surgery. If you have more questions, feel free to come in and talk to us, and we can see if you're a good candidate for PRP.